Tubal ligation reversal. Tubal ligation reversal is a procedure to restore fertility in women who have had tubal ligation, a procedure that cuts or blocks the fallopian tubes to prevent pregnancy. Tubal ligation is often referred to as tying your tubes. During tubal ligation modification, the blocked parts of the fallopian tubes are reconnected to the rest of the fallopian tubes. This can allow the eggs to realign themselves with the fallopian tubes and fall into the fallopian tubes to join the egg. Tubal ligation procedures that cause a small amount of damage to the fallopian tubes are more likely to allow for successful remodeling of the tubal ligation. Examples include interest with tubal clips or rings. Procedures that cause cuts to close the fallopian tubes, such as the ESSER or Adiana systems, are often irreversible. Wyatt-Stun modification of the tubal ligation can allow you to conceive without additional medical help. Tubal ligation reversal is not for everyone. Your healthcare provider will look at a few things to determine if tube ligation modification is likely to be successful, such as your age and body index, type of tubal ligation, the extent of damage to your fallopian tubes, remaining lump, remaining other reproductive factors, such as sperm and egg quality. The success of the tubal ligation reversal procedure depends on a variety of factors. You are more likely to succeed if you still have a large portion of the healthy fallopian tube left. Tubal ligation resuscitation is more likely to be successful if your tubal ligation is initially performed using clips or rings, rather than having parts of your fallopian tubes burned to close them, electrocautery. Other forms of contraception, such as ESSER or Adiana, are not considered flexible. Accidents risks associated with tubal ligation modification include failure to conceive after the procedure. Pregnancy rates following tubal ligation changes vary greatly depending on your age and other factors. Infection, bleeding, the rupture of the fallopian tubes, injuries to nearby organs, neurological problems. Ectopic pregnancy, when implantation of a fertilized egg outside the uterus, usually in the fallopian tube. How to prepare before changing the tubal ligation. Your doctor may explain the details of the process, discuss your chances of success in your pregnancy after the procedure, discuss other pregnancy options, such as in vitro fertilization, IVF. What to expect. Tubal ligation reversal can be performed as a surgical or surgical procedure. During the process, during a tubal ligation transplant, your doctor may use robotic or laparoscopic surgical equipment, small tubes attached to small cameras and surgical instruments, to make small incisions in your abdomen and then reattach your fallopian tubes. Alternatively, your doctor may perform a small incision in your abdomen, mini laparotomy, and examine your uterus, fallopian tubes, and ovaries. The doctor will then remove blocked pieces of the fallopian tube. Try to fix the tube with small stems that can be taken. Your doctor may not be able to reinsert one or both of your fallopian tubes if they are removed too much during the tubal ligation. After the procedure, you can gradually begin your normal activities as you begin to feel better, which usually takes a week or two. Your qualifications will melt and will not need to be removed. Ask your doctor when to schedule a follow-up period to make sure you are healing well. Results. The success rate after tubal ligation modification may vary greatly, depending on factors such as maternal age and the type of tubal ligation procedure performed earlier. While it is difficult to predict pregnancy complications after this procedure, young women, especially those aged 35 and under, often have the best success rates. In cases where transplantation of the tubal ligation is unsuccessful, in vitro fertilization, IVF, may be another option to assist in pregnancy.